Levalbuterol, also known as Xopenex Hfa Aerosol with adapter, is a medication used to prevent and treat wheezing and shortness of breath caused by breathing problems like asthma and chronic obstructive pulmonary disease. It is a quick-relief drug that belongs to a class of drugs known as bronchodilators. Levalbuterol works by relaxing the muscles around the airways so that they open up and you can breathe more easily. It's important to note that this medication is not approved for use in children younger than 4 years due to an increased risk of side effects. Always consult your doctor or pharmacist for more details. Before using Xopenex Hfa Aerosol with adapter, make sure to read the patient information leaflet that comes with the medication. It's important to shake the canister well before using it, and if it's your first time using it or if you haven't used it for 3 days or more, make sure to follow the instructions for test sprays in the air. If you are prescribed 2 inhalations, wait at least 1 minute between them. Remember to keep track of the number of inhalations you use and discard the inhaler after you have used the labeled number of inhalations on the product package. And always have this quick relief inhaler with you. If your symptoms do not improve or if they worsen, make sure to tell your doctor. Some common side effects of Xopenex Hfa Aerosol with adapter include nervousness, dizziness, shaking, trouble sleeping, headache, nausea, dry mouth, cough, sore throat, or runny nose. Let your doctor know if any of these effects last or get worse. This medication may raise your blood pressure, so be sure to check it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience serious side effects like a fast or pounding heartbeat, chest pain, irregular heartbeat, rapid breathing, or confusion. In rare cases, Xopenex Hfa Aerosol with adapter can cause a severe, sudden worsening of breathing problems or asthma, known as paradoxical bronchospasm. If you experience sudden wheezing, seek medical help right away. While very serious allergic reactions to this drug are rare, it's important to get medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist. Before starting Levalbuterol, make sure to inform your doctor or pharmacist if you have any allergies to this medication or similar drugs. This product may contain ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more information. Before using this medication, let your doctor or pharmacist know about your medical history, especially if you have any heart problems, high blood pressure, kidney disease, or a history of seizures. This drug may cause dizziness, and using alcohol or marijuana can make it worse. It's important to avoid activities that require alertness until you know how this medication affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription and non-prescription drugs, as well as herbal products. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is unclear whether this drug passes into breast milk, so consult your doctor before breastfeeding. Using Xopenex Hfa Aerosol with adapter may interact with other medications you are taking, which can affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to note that Levalbuterol is very similar to albuterol, so do not use inhaled medications containing albuterol while using Levalbuterol. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., you can call 1-800-222-1222 to reach your local poison control center, while Canadian residents can call their provincial poison control center. Symptoms of an overdose may include chest pain, fast or irregular heartbeat, headaches, tremors, nervousness, weakness, severe dizziness, and seizures. It's important not to share this medication with others. Your doctor may want to do some lab or medical tests, like checking your blood pressure and heart rate, while you're using this medication. Make sure to keep all your medical appointments. Try to avoid things that can make your breathing problems worse, like smoke, pollen, pet dander, dust, or molds. Your doctor may also suggest using a peak flow meter every day to keep track of your breathing, and to let them know if your breathing problems get worse. And finally, because the flu can make breathing problems worse, ask your doctor or pharmacist if you should get a flu shot every year. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose as usual. Don't take extra doses to make up for the missed one. When storing the Xopenex Hfa Aerosol with adapter, make sure to keep it at room temperature and away from direct sunlight. It's best to store the inhaler with the mouthpiece down and to avoid freezing. Don't puncture the canister or expose it to high heat or open flame, and be sure to keep all medications away from children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.